as a group in Bristol thought there was not enough being done about FGM, so we decided to do a three-stranded conference that targets medical practitioners, policymakers, and also the young people as they are the next generation.
And why especially these three kind of strands?
With the medical professionals, we believe that there was not enough being done by the government to support them about FGM. Similar with the policymakers, they just sort of were slightly clueless about FGM and they didn't really know where to start. And with the youth, we believe that they're the next generation and they're the ones who are going to be making a difference. So we might as well start talking to them now.
And what are your goals?
Our goals are to sort of spread the word about FGM and also to start to let people know that they need to start thinking about FGM. It's a really serious issue here not only in the United Kingdom but worldwide, and not enough is being done, so we want people to start thinking and start working together.
And how are the reactions within the African community in Bristol?
We had mixed reactions. We had some really supportive reactions. For example, like our parents, our mothers were really supportive. But there was also, a few community leaders that didn't really agree with anything that we did. But it was to be expected. We don't have to do this work if we didn't have a position against us.
Of course. Do you think that the British authorities should take serious actions against FGM?
I think it's a mix between education and prosecution. I mean, with prosecution such as France, it spreads the word and people start realizing, this law will be enforced. But at the same time, people need to be educated and they need to realize, the implications that FGM can have on their girls.
And is there enough support for FGM victims in the UK?
I don't believe there is. I mean, for example, we just found out today that Childline is starting to recruit people who are looking into FGM, and they're starting now, and FGM has been around for 30-40 years in the UK, which is quite ridiculous. So I think the government do need to start taking it seriously.
And what about medical care for mutilated girls? How is the situation in the hospitals?
With the medical care, we found out today that there are quite a few clinics out there that can help and support them psychologically and physically. There's, like I said, the government are not really doing enough about FGM.
And what measures would you suggest to take action against FGM?
I would make PHSE, personal health and sexual education, compulsory, just as physical education is, because your sexual health is just as important as your physical health. And I'd also allow policymakers to take FGM seriously. For example, make PHSE statutory in schools where it's not at the moment, but in most European countries it is.
And what will be your next step to end FGM?
Don't really know. Taking it as, we go along and try and find out something new to do every year.
And two more questions. The first is, when did you personally decide to talk about FGM?
I personally decided 3 years ago when I discovered that I didn't really know much about it, and I realised it was a really horrific practice that nobody really spoke about. And it really shocked me because it's a form of child abuse, yet people don't want to talk about it. So me and a large group of girls decided to make a radio project to raise awareness about the subject.
Okay, we as the Desert Foundation, we see FGM as part of the bigger problem related to forced marriage and child marriage, domestic violence, and things like that. What do you think about that?
I definitely agree. I mean, FGM is a sort of a way of controlling women, as simply just as forced marriage and any other form of abuse. And FGM should be taken seriously just as much as those other forms of abuses are.
Thank you.
Thank you.